If you're considering shockwave therapy for chronic pain, tendon issues, arthritis, or mobility problems, one of the biggest questions is probably the same one we hear every single day, and that's, does it hurt? It's a fair question, especially if you've dealt with a painful treatment in the past or if your condition is already sensitive to touch. The word shockwave can sound intimidating, even though the treatment itself is far gentler than people expect. Hello, my name is Dr. Beth Templin, and I am the CEO and founder of HouseFit. As one of the leading providers of regenerative therapy in St. Louis, I want to walk you through exactly what shockwave therapy feels like, why certain areas may be more tender, and how we personalize every session to keep you comfortable while still delivering powerful results. By the end of this video, you'll know exactly what to expect, and you may even feel relieved knowing that the experience is typically far easier than people imagine. So first, what is shockwave therapy? A quick refresher. Shockwave therapy uses high energy sound waves, not electrical shocks, to stimulate healing in damaged or irritated tissues. These sound waves travel into the muscles, tendon, ligaments, or joints and trigger a cascade of biological processes. It's going to improve circulation, reduce inflammation, break down scar tissue, and increase collagen production. In simpler terms, shockwave therapy helps to wake up a healing response in tissues that have stopped repairing themselves. At HouseFit, we use Storz Medical, radial, and focused shockwave. These are the gold standards in regenerative medicine. This lets us target both superficial and deep areas with precision, ensuring maximum benefit with minimal discomfort. So, does shockwave therapy hurt? The short answer is, most people say shockwave therapy is not painful, but you will feel something. For the majority of patients, this sensation is best described as tapping, pulsing, or a thumping feeling on the skin. Some areas may feel more intense than others, especially if the underlying tissue is highly irritated or inflamed. But the key point is you are always in control. We adjust the intensity to your comfort level, and the sensation can be paused or modified at any time. Most clients say things like, "It's not that bad at all," or "It's mostly just pressure," or "It was way easier than I expected," or "I can feel it working, but it's not painful." Let's break down the experience step by step so you know exactly what to expect. So, what does shockwave therapy actually feel like? If you've never experienced shockwave, the first sensation might surprise you in a good way. Here's how clients commonly describe it. Sometimes it's described as a rhythmic tapping or pulsing sensation. The device delivers mechanical sound waves through a handpiece that gently taps the tissue. The rhythm is fast, anywhere from 10 to 15 pulses per second, and that sensation is mild and predictable. This tapping increases blood flow and begins stimulating healing immediately. Some people might report a deep pressure feeling, but not a sharp pain. So this is more common with focused shockwave, and this is because it can reach deeper tissues such as tendon insertions or arthritic joints. And when this energy reaches the right depth, you may feel a deeper pressure, similar to a firm manual therapy or massage tool work. This sensation often gets exactly where the tissue needs the help most. Others report temporary intensity or hot spots. This is exactly where the problem is. So one of the unique features about shockwave is that it often identifies the source of your pain more accurately than we can with our hands alone. When the sound wave hits a dysfunctional tissue, such as a thickening of a tendon or a trigger point or even an inflamed area, it can feel momentarily more intense. Clients will often say, "Oh, that's the spot." And that's valuable because targeting the right tissue speeds up healing dramatically. Others can report immediate loosening or relief. And one of the most surprising sensations people report after Shockwave is the immediate sense of relief. You may feel increased mobility, less stiffness, more fluid movement, reduced resting pain, and not everyone experiences this instantly, but many do, especially in the foot, hip, and shoulder. So why are some areas more sensitive than others? Well, some of our body regions naturally have more nerve endings, less fat padding, or more irritated tissue. These spots may feel more intense during treatment, but they are also the areas most in need of healing. Common tender areas can include the bottom of the foot when we're treating plantar fascia, the outside of the elbow in a tennis elbow, the Achilles tendon, the rotator cuff, the gluteal tendon, which is on the outside of the hip. And the good news is that sensitivity decreases quickly as the tissue begins to heal. Clients often report that the second or third session feels noticeably more comfortable than the first. So how do we keep you comfortable during Shockwave therapy? Well, comfort is always the priority, and the entire experience can be customized to your tolerance. Here's how we do that. We start low and we build gradually. The first few seconds of every session are used to find your comfort zone. We start at a lower intensity and slowly build up as your tissue responds. Your body has a natural ability to adapt to Shockwave, so each wave becomes easier to tolerate as the session continues. You can change intensity at any time. So if you need less intensity, we can adjust it instantly. If you want to try a little higher, we can also increase it gradually. You're never locked into one setting. There's two-way communication to really ensure a positive experience. At HouseFit, we use both radial and focus Shockwave for maximum precision. So different tissues require different energy levels. Focus Shockwave can reach deeper, but it is gentler at the surface, whereas radial Shockwave spreads the energy more broadly at a superficial level. Using both allows us to customize your comfort and get results. Sessions are short, usually 15 to 20 minutes. Most treatments use between 2,000 and 4,000 of those impulses, and they're delivered quickly and efficiently. This brief length helps to minimize fatigue or irritation. So what should you expect after treatment? Well, most people tolerate Shockwave therapy extremely well with minimal after effects. Here's what you may feel after your session. First, you might have some mild soreness, similar to post-workout soreness. This is normal, temporary, and often a sign that your body is responding positively. Second, you might feel warmth, you might see some redness or experience some tingling. These sensations indicate increased blood flow and cellular activity, which is exactly what we want. Third, you might experience improved movement or pain relief. Many clients say things like, I can lift my arm higher already. My heel pain is less intense. I feel looser in my hips. And while full results take time, these early ones are incredibly motivating. There are several reasons why Shockwave doesn't feel as intense as many people imagine. First, it's non-invasive, so there's no needles, no incisions, no medications. Second, this energy is mechanical and not electrical, so there's no electrical shock despite the name. Third, the body adjusts quickly, so after just a few moments, the nervous system accommodates the sensation and it feels more comfortable. Fourth, treatment frequency is high, so that rapid tapping creates a rhythmic pattern that becomes easier to tolerate. Fifth, most areas simply aren't painful. Only pathology-specific areas tend to be tender, whereas healthy tissues feel much more comfortable. So what if you have a low pain tolerance? The great news is you can still safely and comfortably undergo Shockwave therapy. We have many clients who consider themselves highly sensitive to touch or pressure, and they are often surprised by how well they tolerate the treatment. Your comfort is always the guide, and we never push you beyond your tolerance. So why do we get excited, and why is sensation actually a helpful indicator to us? The spot that feels more tender during treatment often correlates with the exact source of your pain. This helps us to pinpoint dysfunctional tissue, treat the root cause, monitor your progress, and adjust your treatment plan over time. As you heal, these sensitive spots become less reactive, a clear indicator that your tissue is improving. The bottom line, does shockwave therapy hurt? Most people describe it as mildly uncomfortable at worst and surprisingly easy at best. It is not a massage, but it is also not a painful procedure. And the temporary discomfort is far outweighed by the long-term benefits. You'll have less pain, better mobility, faster healing, you'll avoid surgery, and experience an improved quality of life. Shockwave therapy allows you to take control of your healing in a natural, powerful, and non-invasive way. Interested in trying Shockwave? Let's make it easy. If you're curious about shockwave therapy but nervous about how it might feel, don't worry, you're not alone, and we're here to walk you through it with compassion and expertise. At HouseFit, we offer free consultations, customized treatment plans, and options to combine shockwave therapy with EMTT and physical therapy for even better results. If you're living with chronic pain or stiffness and you're ready for a treatment that helps your body to truly heal, shockwave may be the answer. Take the first step. Your body will thank you.